Good afternoon, everybody. The chairman of the Presidential Task Force on COVID-19 Response and Secretary to the Government of the Federation, honorable ministers, permanent secretaries, the National Coordinator, Director General, ladies and gentlemen. I join the Secretary to the Government in welcoming all citizens back from the Salah break, and I hope it served as well a period of celebration and thanksgiving as it must have done for some reflection, which under the prevailing circumstances cannot but dwell on the greatest public health challenge of our generation, the COVID-19 pandemic, and the adverse effect and impact it has had on societal and economic life in our country and also globally. As the cause of this disease becomes a little clearer, experts are hazarding cautious guesses. The Director General of the World Health Organization has advised, for example, that COVID-19 could be with us for a long time. This means that we are all to consider adjusting to what has been described as the new normal, a way of life that is intended to reduce risk of infection while allowing meaningful economic life to resume and for citizens to restore their livelihoods. This will mean that there will be more movement, more traveling, and also more commerce and activities. We must not lose our bearings in spite of all of that. All members of the Presidential Task Force are aligned in the key role of non-pharmaceutical interventions in controlling new infections, especially as the economic space begins to open up. Because the measures are easy, they are cheap, and they are proven to be effective, and especially the wearing of masks, avoiding crowds, washing hands, using sanitizers. I urge all citizens, in spite of going about their activities, not to slacken in their adherence to these important measures. We in the health sector are key actors in the health-related parts of our response. Our objective is to reduce case fatalities to less than 1% from the present just over 2%. And we are working on innovative interventions with prospects of improving survival chances, especially for the elderly and those with comorbidities. We shall work with state governments to prepare the necessary space and human resources at general hospitals or primary healthcare centers for the human resources to be trained for setting up at least one sample collection site at every local government area in due course, with efficient sample retrieval logistics to convey samples to laboratories. This is ambitious, but we must have concern that COVID will also spread to small towns and to rural areas, and prepare ourselves for that. For patients with significant clinical symptoms, we also plan the designation of holding rooms at general hospitals so that patients are not rejected. Simple holding rooms with facilities for oxygen administration, particularly for those who come in distress. We require things like oxygen concentrators or even oxygen cylinders. Some investment in this strategy, which is already in use in Lagos State and known as oxygen kiosks, will be required, but the benefit in lives saved will be significant. With regard to the COVID-19 scene in Nigeria, today, Monday, the 3rd of August, we have on record 43,841 confirmed cases out of a total of 286,091 samples tested so far, while 20,308 persons have been treated successfully and discharged. 888 persons have sadly been lost as a result of COVID-19. No meaning can be read into this as yet. It is too early. But in a month-to-month comparison, the total number of COVID-19 positive cases recorded in July was 17,457 out of a total test sample done of 154,454 tests, with a positivity rate of 11.3, while in June 2020, the figures were 19,149 positive cases from a total of 111,052 samples tested and a positivity rate of 17.2. Again, it is too early to draw conclusions, but it is noteworthy that the testing increased by over 40,000 in that 1 month from June to July, while the number of positive cases dropped by more than 2,000. We must not rest on our oars, and what we see is just suggestive of the fact that at least our strategy is not failing. We must continue to sustain our efforts. I wish to assure our health workers that there should be no anxiety about personal protective equipment, as we are reasonably well stocked with materials and commodities which have been supplied to all sections of the country. And at the directive of His Excellency the President, as we just heard, we were also in fact able to respond to the request of a neighboring country of Sao Tome for commodities for their own COVID-19 response, and to send a consignment to a sister country requiring support. I also wish to assure our citizens that we are continuing to increase and optimize laboratory diagnostic capacity, most recently in Zamfara, Kebbi, Yobe, Taraba, Gombe, and Bayelsa states. On behalf of the government and people of Nigeria, I once again here express appreciation to the United Nations systems in Nigeria, made up of several groups, including the World Health Organization, here represented by the African Nigeria representative, country representative, and also to the European Union for their generous donation of yet another consignment of valuable supplies, which I had the privilege of receiving at the airport on Friday, the 31st of July, 2020. This additional delivery will boost our stockpile of wherewithal to fight the pandemic, and it includes face masks, shields, goggles, airways, tubes, biohazard bags, safety boxes, test kits, etc. I want to assure our donors and partners that all of these materials will be put into judicious use in fighting COVID-19. On another note, Nigeria joins the rest of the world this week to celebrate World Breastfeeding Week, marked annually from the 1st to the 7th of August, to create awareness of the importance and value of breastfeeding. The theme of this year's celebration is breastfeeding for a healthier planet. This is a good opportunity to emphasize it at this time when the world is threatened by this pandemic of the need to nourish infants properly. I encourage all mothers to continue the practice. The Honourable Minister of Women's Affairs and I will hold a joint press briefing tomorrow as part of the activities of that day. I thank you all for your attention.